What's up, guys? Welcome back to the nursing channel. So in this video I'm just going to quickly talk to you guys about how I got into nursing case management. So it's my story is very simple. So as you guys know, I started off as a bedside nurse. I did that for a few years, and then I honestly got burnt out just doing patient care. I'm not gonna lie, I didn't see myself doing that for a long time. So anyways, I started looking into other areas of nursing, and luckily I found nursing case management. And I slowly started to talk to some of the nurse case managers on the floor, and I just told them like, hey, what do you guys do? I always see you guys dressed up so nicely in nice clothing, and I was just wondering like, what do you guys do? Because you guys have that registered nurse badge, that RN badge, but you guys don't do patient care. So what is it exactly that you guys do? Is what I asked the nurse case managers, and they started to explain to me that it primarily entails like paperwork, communicating with the doctors and members of the interdisciplinary team, and just coordinating care for patients and making sure that patients have all the resources that they need before they leave the hospital. And so once I got that information from them, I tried to become friends with the director of the case management department, and I got close to her and I told her like, hey, like I'm actually interested in I'm actually interested in becoming a case manager. I just don't know how to start. I've done bedside nursing, and I want to try something different. And I told her, and I think nursing case management might be a good option for me. And when I told her that, she was like, oh, well, how about you shadow some of the nurse case managers in my department, and then you decide if this is the route that you want to take. And so I actually ended up doing that. I shadowed some of the nurse case managers, and I actually really enjoyed the work that they did. And it was definitely different, but I actually liked it. I didn't have to wipe butts, didn't have to give medications, didn't have to really deal with all the BS that patients have you make you put up with. And so that was really nice. That was like a breath of fresh air. So anyways, after I spoke with the case management director, I told her, hey, I actually really enjoy the work that you guys do here in nursing case management. And so she's like, you know what, Sam, luckily we have an opening. How about you apply to that position, and then we'll schedule you for an interview. And so yeah, luckily I got interviewed, and I dressed nicely for the interview, and I was already a little familiar with what nurse case managers did, so I was able to answer their questions appropriately during the interview. And so they really liked my responses, and luckily I got the position. And that's how I got into nursing case management. I didn't have any nursing case management experience before that, and I was basically a blank slate, and I got the position. Sometimes you just gotta open your mouth, like that saying says, the squeaky wheel gets the grease. So if you keep your mouth shut, you're not gonna get the grease. So that's how I got into the position. And as a nurse case manager in my department, I've actually seen a few people that got hired as nurse case managers being new graduate nurses. And I was really shocked, because normally the qualifications to become a nurse case manager is they want you to have experience already, at least in bedside nursing, and they want you to have a bachelor's as a minimum to apply for the job. So I've actually seen some new grad nurses, believe it or not, get positions as nurse case managers and having no experience as a nurse at all. So I was really shocked. So my advice to you guys is, if you want to become a nurse case manager, just apply for the position wherever, whichever hospital you're at. If there's an opening, just apply for the position. You never know. Once you get the interview, try to sell yourself and try to get that position. It doesn't hurt to apply for a nursing case manager position. The worst thing that they can say is no, which you already got to know with not applying to the position. So, you have nothing to lose. Apply for the position if that's something that you're interested in. There's also a few things that you can do to stand out as a candidate for the nurse case manager position. Is you can try to get some certifications. I personally never got certified, but some of my coworkers do have certifications in case management. There's a certification called Commission of Case Management certification. It's called CCMC. So Google that, and you have obviously there's a booklet that you can buy to study for that exam. But anyways, I believe the application is like about a little over $100, and the actual test is like $185. So it is pretty pricey. Yeah, once you pass the test and it's online, and they'll actually send you your certification via email if you pass it. But anyways, if you do decide to get a certification, that will definitely make you stand out as a candidate for a nurse case manager position. So I highly recommend that if you do want to give nursing case management an opportunity. All right, guys, I will talk to you guys later. Don't forget to like this video. Don't forget to subscribe to this channel, and I appreciate all my supporters. I'm trying to answer all of you guys' questions every day, but you know, bear with me. I'm only human, so I also lead a busy life, so I'm not able to get to everybody, but I try to get to everybody as much as I can. All right, guys, I love you guys. See you guys on the next one.